Hello everyone, I am Dr. Gaurav Agrawal, Interventional Pediatric Cardiologist. I just want to highlight regarding the congenital heart diseases that are present in the infant and pediatric age group. What is the meaning of congenital heart diseases? Congenital heart diseases are the heart defects that are present in the pediatric age group population since birth. There are various types of congenital heart diseases that can be acyanotic or cyanotic. Acyanotic means when the patient is not having cyanosis, and the cyanotic means when the patient is blue since birth. The most common acyanotic heart disease is the ventricular septal defect that is present between two chambers that are situated below, and the others are atrial septal defect, the hole that is present between the upper chambers of the heart. Others are patent ductus arteriosus and AV canal defect. And most common cyanotic heart disease is the tetralogy of Fallot, in which when the patient cries, the patient becomes blue. Sometimes patient is blue at rest also when the disease progresses. How the patient presents? In neonate, if the patient is having cyanotic heart disease, the child is blue since birth or becomes blue or after 48 hours of birth. Few neonates presents as a shock-like condition in case of critical aortic stenosis or coarctation of aorta or hypoplastic left heart syndrome. The question arises, how can we diagnose these type of heart defect before birth? We are providing the fetal echocardiography, in which we can diagnose majority of the cardiac lesions during pregnancy state. The most ideal time is between 19 to 24 weeks of pregnancy. If we diagnose before 20 weeks of pregnancy, then we can guide patients accordingly the risk and prognosis of the illness. After the birth, how can we treat such type of cardiac problems? If the patient is very sick since after birth, then according to the cardiac lesion we can plan the treatment. And if we are diagnosing the problem during the fetal life, then we can advise the attendants or parents to deliver the child in a tertiary center where the pediatric cardiology facilities are available. The pediatric congenital heart diseases are treated by two methods, either by transcatheter method, in which we close the holes by device method like atrial septal defect device closure, ventricular septal defect device closure, PDA device closure, etc. Or we can treat cyanotic heart disease, for example, in case of VSD pulmonary atresia like conditions in which there is a patient is surviving due to the PDA, in that we can do the PDA stenting also. Or if the balloon treatment is required as in case of aortic stenosis or pulmonary stenosis or coarctation of aorta, then we can dilate the valves or the vessel by the balloon. In extreme cases, we can open the vessel by the stenting methods. In case of cardiac tamponade, we provide the pericardiocentesis also. There are various types of pediatric cardiac surgical treatment available in BLK super specialty hospital. The incidence of congenital heart diseases are 5 to 10 per 1000 live births, that is very high in number. So, if we are diagnosing the cardiac illnesses within a time period and managing the kids with a proper treatment protocol and within a good time frame, then we can save a lots of life, pediatric age group life all over the world. And one more thing, besides the congenital heart diseases, if you want to inquire more about the other types of problems that is besides the cardiac problems, you can subscribe the BLK Super Specialty Hospital website and also the YouTube channel of the BLK Hospital.
BLK Super Speciality Hospital, a passion for healing.